We now know more about who is at the highest risk for severe COVID-19 complications. The CDC releasing an updated and expanded list of underlying medical conditions of those who are most vulnerable to the disease. The CDC now points to evidence that medical conditions such as heart disease, COPD, or type 2 diabetes put you at a higher risk. And researchers are also addressing risks specific to pregnancy, finding that expectant women are more likely to be hospitalized and placed on ventilators. You'll find more on the new guidelines under the coronavirus section of 11alive.com.